Hello, I'm Nora Hart with Fox 12 Oregon. Cardiovascular disease has not taken a break during the pandemic, and neither has the American Heart Association. In fact, its work is more important than ever. Women continue to face cardiovascular disease as their biggest health threat. Currently, nearly 45% of women aged 20 and older are living with some form of cardiovascular disease. Cardiovascular conditions are the leading cause of death during and shortly after pregnancy. Almost two-thirds of these deaths could be prevented, experts say. And women in their 30s and 40s are more than twice as likely to die from cardiovascular disease than breast cancer. The pandemic has put additional stressors on mothers and working women. The need to address mental well-being has increased, and as of 2021, 1 in 4 Oregonians now face food insecurity, and 30% of women in Oregon fall far below the federal poverty level. Women continue to be pushed and challenged, and unfortunately, this is often negatively reflected in our health and well-being. That is why the American Heart Association's Go Red for Women movement, with our support, is working to break down barriers to health in our communities and educate all women on how to fiercely take charge of their health. Currently, nearly 2 million people in Oregon and Southwest Washington are living with uncontrolled high blood pressure. AHA's Target BP program aids healthcare organizations in improving high blood pressure rates in local communities. The AHA recently gave 80 blood pressure cuffs to the Portland Clinic to start a self-monitoring program, reaching more than 37.5 thousand Portland area patients. The Vancouver Clinic was given 180 cuffs, which are being used to improve blood pressure measurement for more than 140,000 patients in Southwest Washington. And the AHA's Local Giving Society recently donated blood pressure cuffs to the Quest Center to support low-income clients with home blood pressure monitoring. This is local donors making a direct impact. On the advocacy front, the AHA continues to fight for policies that address inequities. Earlier this year, the AHA led the passage of a measure that requires all tobacco retailers in Oregon to be licensed and have annual inspections to make sure they aren't selling to minors. More than 1 in 4 Oregon high schoolers report using electronic cigarettes. This check among retailers aims to help curb the youth vaping epidemic. To increase nutrition security, the AHA advocated for Double Up Food Bucks, a program that helps Oregonians buy more fresh produce at farmers markets and participating grocery stores. Double Up Food Bucks is an established and successful program, yet only 4.5% of people participating identify as African American, Latinx, or Native American. Thanks to support from Bob's Red Mill and the Safeway Albertsons Foundation, the AHA is tackling this access disparity with direct outreach to communities, ensuring more fruits and vegetables for all families who qualify. Speaking of investments, the AHA is supporting women entrepreneurs and their solutions to address local needs and increase health equity in their communities. On September 30th, the American Heart Association, generously supported by the Marie Lampram Foundation, held an Empowered to Serve Business Accelerator in Portland. 6 women working on projects to increase health in the community shared their business stories and competed for financial grants to scale their projects. The local accelerator was specifically designed to identify and empower female entrepreneurs. As we know, we need women-led solutions, and yet women are too often underrepresented and their startups and ideas are underfunded. Congratulations to the 3 local award recipients. We can't wait to see your innovative solutions in action in our community. This is local impact being made. This is the AHA's mission at work, thanks to you. That's why we're here today, to acknowledge the needs in our community, celebrate momentum being made, and thank you for helping the American Heart Association build healthier communities for women everywhere.